Hello, my name is David Ryan, and this is a case study on idiopathic anaphylaxis with elevated liver enzymes. Anaphylaxis is described as an allergic reaction caused by an allergen. This could be food, venoms, medication, infections, exercise, among many others. Idiopathic anaphylaxis, however, is a severe allergic reaction with no known trigger or no known cause. This case report starts out with a 48-year-old female who presented to her PCP complaining of upper mid-thoracic back pain. She was referred to physical therapy, but this did not resolve any pain. An MRI was eventually taken that showed cholecystectomy, and a subsequent laparoscopic cholecystectomy was performed in December of 2013. While coming out of anesthesia, the patient reported severe middle epigastric pain that radiated posteriorly just inferior to the medial border of the scapula. This was taken care of at the hospital and she was released home. Several hours later, she began experiencing severe urticaria in the areas of the groin, elbow, and popliteal regions of her knees. Additionally, she began having difficulty breathing with general anaphylactic symptoms such as sensations of throat swelling and difficulty speaking. She was taken to the ER where she was eventually treated, and a blood clot analysis showed elevated ALTs and AST levels. She had many tests done, including allergy challenges, which showed nothing abnormal. In December of 2013, during one of these episodes, an MRCP was performed which demonstrated a slightly tortuous bile duct. An ERCP was eventually performed at the Mayo Clinic, which showed a sphincter of Oddi dysfunction. After a sphincterectomy was performed, she had one last episode, and since then, since 2018, she has had no episodes. There is no clinical literature with her set of symptoms after a laparoscopic cholecystectomy. But there was shown that in dogs, that raised ALT levels did significantly correlate with anaphylaxis, although there is no proof of this in humans. With this case report, we wanted to gather as much information as we can from the literature and try to propose a mechanism for why this was happening. In our conclusion, this is the mechanism that we have proposed. The laparoscopic cholecystectomy, or a gallstone moving through the sphincter of Oddi, caused the sphincter of Oddi dysfunction. The sphincter of Oddi dysfunction was also the causal factor in the elevation in liver transaminases, which in turn caused the radiating epigastric pain and might have also caused urticaria and anaphylaxis. It remains to be seen why the sphincter of Oddi release has correlated with this patient not experiencing her anaphylactic episodes for the last 6 years. While this is not inconclusive, it is suggestive that since the sphincter of Oddi release has resolved this patient's symptoms, lends credibility that anaphylactic reactions were related to her sphincter of Oddi dysfunction. More study is warranted to find a possible correlation between sphincter of Oddi dysfunctions, elevated liver transaminases, and anaphylaxis in humans to determine whether these symptoms are associated.